so I serve a very underserved population in Dallas County. I serve pretty much an exclusively minority population. And so a lot of emphasis is placed on these, on healthcare disparity and these social circumstances that can impact acquisition of care. For example, transportation and childcare, and how do we make it easier for our patients to seek out care? And it can be, do they have access to resources for copays? Do they have access to Wi-Fi? If you would like to provide them information, as we frequently do now, that's electronic. And you really have to take all of those things into account. The benefit of working in the environment in which I work is, because I'm in a public hospital, it's a tax-exempt organization, we do, through the Affordable Care Act, we have done these community health needs assessments that we have to do by law every 3 years. And you start studying patient outcomes, morbidity, mortality, life expectancy, and the disparities you find depending on what zip code you live in and who you are really dramatic. And so you have to know that,
yes,
in order to then start working towards solutions to serve your patients. And so if you don't really take the time to get to know, what the situation is for your patients, you can't do that. So I think that would be a very, that experience I have would be very different from someone who's perhaps serving a more affluent, homogeneous population in Dallas, who will simply say, you can't bring a child to the doctor's appointment. And if you don't have childcare, please reschedule. How many patients are then precluded from getting the health care that they need, and what is the long-term impact of that on their health and the health of their family?
What would you suggest to clinicians that don't have that access to those surveys? Maybe they work at a different hospital that doesn't require that. How would you suggest that they go about surveying their patients and things like that, getting that data?
It's not easy. You have to be proactive, and it takes time and it takes energy. And Dr. Nesbitt and I have had this conversation of, providing perhaps surveys to your patients to find out, to ask. Again, it always comes back to asking, what can we do to help you and make it easier for you to access healthcare? Mm-hmm. And you can presume what the answer is going to be, but I guarantee you what you'll find is there will be some surprises in there. And I think what you can do is, you can't perhaps solve every problem, but you could make some small changes that might really impact someone's life. So I think asking is really, really important. And I think you can do that actually pretty easily with surveys and things of that nature.